as a trans person, going along to primary care, to a GP, or booking an appointment, particularly when you're at the beginning of your journey, it's very important that people don't misgender you. And of course, at the beginning of the journey, you may not present as well as you perhaps do later. So it can be difficult for people. And on the phone, the voice may not be what people are expecting. So if you're a trans man, for instance, you may have a higher voice, and as a trans woman, you may have a lower voice. So it's really important that people ask you not only your name, but which pronouns you prefer. And of course, there are some people who aren't either wanting to identify as strictly male or female, and they prefer pronouns like they, their, them. So very important you get that right. And it is particularly hurtful when you're starting your journey to get misgendered, and it takes away your self-confidence. People need to understand, particularly in regards to cancer, and if it's cancer of parts of the body that you haven't owned or assimilated. So for instance, if you're a trans man and you think you might have a lump in your breast, a lot of trans people will think, I'm not sure the service is going to treat me well, so I'll just ignore that. And there's almost the thought, well, I don't care if it gets malignant, that'll get rid of it. And it means that often people don't go for help till it's really serious, or maybe even too late. One of the other things that trans people are very against is being outed by the clinicians. And sometimes it's really necessary. You know, if you've got a trans woman and you want to refer them for further treatment, maybe there's a suspicion they've got an aortic aneurysm. You need to tell whoever they referred to that they have a male history, because men get aneurysms 4 times more often than women. So it's really important you know that. But the trans person doesn't want you disclosing their history, and what we need to get the health professionals to do is, before making that disclosure, having a conversation with the person and saying, look, I'm not outing you just because I want to out you. I need to get your permission to disclose this because it's clinically relevant and it will impact on your treatment if the other clinician doesn't know this. So it can be much more, in a way, apparently complicated, but actually a few simple rules and a little bit of awareness will solve those sort of problems.